welcome to my channel, The Ready Nurse Nay. On this channel, I make nursing videos about health, inspirational, and of course, nursing related topics. I haven't been on here in a little minute, but you know what, I'm back. A little bit about me. This is my last nursing semester, and I graduate in like 3 months. So we're in the end of August, beginning of September 2023. So I am so excited. I graduate on December 9th. Woo woo! And I am so excited. If you have been enjoying the journey, go ahead and like and subscribe, okay? I'm gonna try to keep this video very short, 5 minutes max. So if I'm going too fast, or if you have questions or anything, please drop them down in the comment section below and I will get back to you, okay? So today's video, if you judging by the topic, is about how to stay organized during clinicals, okay? You know, the biggest thing, this is something that I guess was on my mind when I first started nursing clinical, taking care of patients or whatever. When I had one patient, it was fine, right? You just have one patient, one piece of paper, write it all down and you're good to go. When I got to have 2 and 3 patients at my school, and even 4 patients at my school, in 2nd and 3rd semester, you can get 2 and 3 patients that you're fully taken care of, and in your last semester you can get up to 4 patients that you're fully taken care of. I definitely needed a way to keep them organized. So a lot of times your school will provide what's called a nursing report sheet or like a nurse brain. Sometimes different units on the hospital have their own. You can even Google nursing report sheet, nursing brain, and that is how they keep all of that information about their patient kind of organized so that they can use that to chart, document. They can follow up on what needs to be followed up on. It keeps them organized, because that's, you know, if you're having like 4 patients, 6 patients, you have to have some type of way to like keep all the information organized, because you're going from patient room to patient room. You need something to hold that information so that when you sit down, you can chart the proper stuff, right? So this is ways, these 2 sheets are something to help you. So the first thing, staying organized, get there early. If you are a nursing student or even a new nurse, graduated nurse, getting to your shift early, and I'm talking just maybe 10-15 minutes early, just to give you enough time to like walk around, get some coffee, sit in the break room and chill. It can help keep the anxiety down, because a lot of times when nurses get there late or students get there late, you're kind of like in the midst. You're late, your nurse is already giving a report, you're missing stuff, you know what I'm saying? Like, just so get there early so you have enough time to just relax your mind before you actually start your day. So like I said, the first semester of nursing school, we only had 1 patient that we had to do everything on. So I was able to use 1 sheet of paper, write everything down, and stay organized. And it kind of looks like this. I'm gonna zoom it so hopefully you can see it better. And I basically, it's just a sheet of paper, and I actually kind of made this so you can make your own nursing report sheet, and I would just fill it out. Patient information, the room number, admitting diagnosis, you know, when they came into the hospital, all their meds, the nurse report, and then I had a little space for vitals and lab signs and any like imaging results. And I was able to keep track of what was going on for my patient, document that, and if anybody asked me a question about it, I was able to look at it with the sheet, okay? Having 1 patient, that worked well. But when I got to my 2nd and 3rd semester and 4th semester, where I started having 2 patients and 3 patients and 4 patients, like, I needed something a little bit more detailed than that to keep track of all the patient information, because you might have, out of your 4 patients, you might have 3 that are on AccuChecks. 1 might be on AccuChecks every time, you know, 3 times a day and before bedtime. 1 might be on AccuChecks every 6 hours. 1 might be on AccuChecks every 3 hours. 1 might be having pain meds, and they have pain management that you're trying to control, and they're taking pain meds every 2 hours. The other one might be having nausea and vomiting, and you're having to give them antiemetics every so often, every few hours, whatever. So having this report sheet helped me to keep track of that. So 4th semester, started having 2, 3, 4 patients. I had my clinical instructor showed me this, and it helped me to keep track of my multiple patients. So there's 2 different ones. One looks like this. You can kind of pause the video and snapshot it, and then just kind of create this document yourself, or you can Google it. So basically, one here, you have your patient 1, 2, 3, and you could flip it on the back side as well. And it goes from 7 to 15. And basically, you're able to put stuff, you know, for each patient. So like at 8 o'clock, you're able to put their vitals down. 12 vitals. If they have AccuChecks, put that on there. If they're having, you know, scheduled pain medicine or antiemetics or something, you're able to schedule that on there. And you can do this, have, you know, on the front and back, and that covers all 6 of your patients. Another one, it looks like this. Again, you can pause this and kind of snapshot it and then create this document. But patient 1, 2, and 3, and you're able to kind of capture all of the major stuff that's going on with each patient. That way, when you're walking to the patient's room, you're not confusing patient, you know, 1 and 2 with 3 or 4. You're able to, like, okay, I'm in Betty Bop's room, and Betty Bop got this going on, so this is what I'm assessing for Betty Bop. Then I go into patients 2. Mickey Mouse got this and this going on, so I'm assessing this every few hours. You're able to kind of keep it organized so you're not confusing up your patients, okay? So that's one right there too. So I think eventually this is something that I think I'm going to use. I will probably use even as a new nurse, because it's just a really seamless way of keeping the patient information organized. And I could see me even, I thought about even taking this one and say, for instance, just using the full page for one patient. If I'm working a 12-hour shift, I would literally have it go from 7 a.m. to 7 p.m. and I would have, you know, the first 6 hours up here and the first 6 hours down there. So it'd be like one page would split for one patient, and then I would flip it on the back, and that would be the second patient, and I would do it like that. So I thought about, you know, different ways to change this up. But again, I'm gonna go ahead and show you what these sheets look like. You can snapshot them, pause this video and snapshot them, and kind of create these on your own if there's something that you would want to use, if they look beneficial to you. Or you literally could Google nursing report sheet, Nurse Brain, and it'll come up with all kinds of nursing report sheets that will help you stay organized and keep your patients organized during your shift. Okay, I hope I didn't talk too fast, and I hope this was helpful for you, but I already see I done passed that 5 minutes, so I'm sorry about that. I'm hitting that 7-minute mark, but I hope this was helpful to you. If you have any questions or anything, if I knew how to attach this to this YouTube video, I would just attach it as a Word document, but I have no idea how to do that. So the only thing I can say is if you pause the video and just kind of screenshot that report sheet if it was something that you think would help you, and then you just create it yourself, or you could just Google and kind of use from there. So love you guys, peace, love, and blessings. Stay tuned for many more videos. I will definitely be trying to I'm gonna try to post at least a video every weekly starting in September of 2023, going all the way through the end of this year. So from September to December of 2023, my goal is to post weekly videos. Like I said, this is my last semester in nursing school, and I graduate in December. So my goal is any type of video ideas that I have regards to schooling, I want to get those posted now while it's fresh in my brain, because once I start working as a nurse, that's what my videos are going to be about. I'll be talking about how it is to work as a nurse and whatever unit I work in. So I hope you guys come along from the journey. I'm going to post some interesting videos. They're going to be funny, they're going to be cool, they're going to be sad, about my journey. Definitely go back and look on my channel, catch some of my old videos. I talk about all of my clinical experiences all over the hospital. I talk about story times from working in the hospital as a nursing student. I talk about just juggling being a wife and a mom and a nursing student on this crazy journey that I've had that is almost coming to completion. So definitely go check my page out, like it, subscribe, check out some of my old videos and some comments, okay? And yeah, I love you guys, and peace, love, and blessings, and I'll see you in the next video. Bye!